So for us, it's been a journey of figuring out how to do peer support in Singapore, and being able to meet with different people who practice that, and gone through different experiences, learning through challenges. That will be really, really helpful for us as we try to look into our program and how to refine it. So thank you everyone for having us here, and thanks in advance for all the things we're going to learn from today.
Yeah, not at all, Justin. And yeah, it's so great. And I think just that opportunity for shared learning and connection is so important, and hearing different ways of doing things. And I guess for this conversation, maybe we could just start off hearing a bit more about, Resilience Collective and really the context that you're working in, the organisation, some of that kind of stuff to start us off.
Sure. So Resilience Collective, or we'll call it RC for short. We are a fairly young agency in Singapore. We were established in 2018. And in the past, the work was largely scattered. So we did a bit of online peer support programs. A large portion of our programs were then a bit more mental health awareness. We ran workshops, we ran events as such. But since 2022, I think we kind of pivoted a bit of our services to be more targeted at peer support itself as a core program. So we started this program called the Circles of Resilience, which we'll share a bit more in detail later. And the team is a pretty small team as well, 9 people within the team, and 7 of them are in the program's team itself. So Rachel, that's on the call as well, she's our executive director, but she's also heading up engagements within the company. So in terms of what we do, or maybe why we do it, RC exists largely to fill the gap that we felt or we identified within the Singapore's mental health landscape. A lot of the services here, if you speak to professionals, you speak to the guy on the road, a lot of them, when they talk about mental health services, it's going to be about seeing psychiatrists, psychologists, counselors, and those are utterly necessary, because I myself, I see a psychiatrist as well. I'm a peer myself. But we felt that there was something a bit missing. We really wanted to be able to have a program that builds community for peers as they go through recovery together, and also a program that actively empowers the peer to take ownership, to own the sense of their experience, to own where they've come, the efforts they've gone through, even to go to the next step of using their lived experience to support other people. So I think that's largely what drove us to conceptualize the Circles of Resilience. And that's what drives the team right now, to be able to take on that strength approach towards working and serving the peers in Singapore.
Thanks, Justin. It's really interesting to hear that bit of context, and just how you've kind of identified the space for the organisation within what else is offered in Singapore. So, it is largely about psychiatry and seeing psychologists, and there is a role for that, absolutely. But actually what you've shared is that you could see that gap in, bringing people together to build a sense of community, having intentional opportunities to use experience. And it's really inspiring to hear the role that lived experience plays throughout the organisation, that, you speak about being like truly peer run. And I think that, and just hearing you talk about some of the values that drive you. Thank you. Out of interest, as a sector, a lot of us work in a sort of charity sector, the third sector, NGOs. Is that a big sector within Singapore, where you sit, or what does that look like?
Yeah, there are quite a number of so in Singapore we call them social service agencies.
Yeah.
So there are quite a number of social service agencies in Singapore serving different needs, and there are also quite a number of SSAs, social service agencies, that are serving specifically the mental health needs. A lot of them, I think, similar to the landscape we shared a bit earlier. A lot of them are doing casework, individualized casework. There's huge number of them that are working towards more awareness for mental wellness in general. So that's also therefore the gap that we saw, that we wanted to come in to really bring peer support into the sense of understanding of what a mental health service can provide holistically, beyond just a typical talk therapy, or at least in combination with talk therapy.
Yeah, amazing. Thank you. So I think that will have given people a bit of a sense of the organization, kind of what it looks like and where you sit within the Singaporean context.
The Circles of Resilience is it's a version of peer support group program that I think we scrapped together from different research and conversations with people here and there. Essentially, they are monthly peer support groups that run, and how we have kind of structured. So operationally, how we've done it is we break them up into the first and foremost different age groups. So we have CRs that are catering to peers that are from 18 to 24 years old. And then there are other CRs that cater to peers that go from 25 onwards, right? So different life stages, different lived experiences that they might go through that they hopefully can find relevant for each other. And within the CRs themselves, right now, when we first started, in fact, when we first started out, large portion of it was staff driven. So it's facilitated by staff. And when the members meet, they go up to a total capacity of 25 members per Circle of Resilience. And for each group that we establish, once it hits that max capacity, it becomes a closed group. Right? Something different that we're trying, and we wouldn't honestly dare to say that it's sustainable or it's the right way to do it per se. But something we're trying essentially is that the sessions run perpetually. So the groups, there isn't a start and end to a group. So maybe in comparison to a group that's largely existing for psychoeducation, that have fixed sessions, like 1 to 8 sessions. Ours run in perpetuity. And the idea was that we wanted to establish small communities for peers to build relationships, to build familiarity and safe space with. So they meet once a month, and the session topics that they discuss, we are guided by the CHIME framework. So within each component, connectedness, hope, optimism, identity, meaning, empowerment, each component, so for example, connectedness, for 4 months, all the topics for that 4 months will be on relationships and social support. Similarly, for the next 4 months, and so we break it out that way. And what happens is for every CR session, we are guided by something that we kind of came up with. Once again, we don't know whether it's going to be the perfect system, but what guides us, at least on our side, is what we call the 4 R's. So the first R is ready. Ready happens before the CR session even begins, right? This is when we send so each of them have a Telegram group where they all connect online. And every time before the session, we would send topics for the group to select and vote on which topic would you guys like to talk about in the upcoming session. And it also, for ready, it also means that we meet together for dinner before the CR session itself. So we have some members who have time to come after work or after school will join up just to connect casually, informally before the session starts. So after ready, we go into receive. So this is typically the first half an hour of the session. And receive is where we sit down, we do what we call a mental health check, right? Check-in. So we have a board and there are different categories, whether you're doing great all the way down to you're really not in a good space and you need support. So each member takes a magnet and they were to paste their name on where they are and share what kind of state they're coming in to the program and to the group. Then we go into the third R, which is relying. So this is the main segment of the group where we rely on each other's sharings and support. We talk about the topic that was chosen by the group of the day. And this is facilitated by either the staff or volunteer peer support facilitators. And then the last 5 or 10 minutes, we go into the last R, which is rally. That's where we share certain successes. It could be certain volunteers that shared their lived experience over social media, or they participated in certain events. We would share these up on the screen so that we can all celebrate together. So these 4 R's basically guide what every peer would receive and go through for each CR session.
I love that, Justin. I love the structure. Well, the first thing I wanted to pick up, I was scribbling notes just then, and the first thing I picked up on was how CHIME is embedded, and I think many of the participants here today will be familiar with CHIME, Rally, fab. So many of the participants here will be familiar with CHIME, and at Scottish Recovery Network we use it a lot, and it's really interesting to see how that is totally embedded in the kind of framing of the Circles of Resilience and how you approach it. But then that very specific structure that you go through within a session, I think Yeah, there's just something about it that's very powerful. And I think it gives like a real sort of consistency and I think, a real sense of kind of understanding of, what's going to happen, what the structure is, what the approach is. And I love that, you're very open about the fact that you're trying new things, we're going to give this a go. We're not sure if it's the right way or if it's a sustainable way, but we want to try it. And I think that's, that kind of approach is really important within developing peer approaches. Is if we don't try, we shy away from trying things, and they don't happen. Yeah, wonderful. That's really really great to hear. I was interested in you spoke a bit about the facilitation, and you said earlier the circles of resilience were facilitated by staff, but my understanding also is that staff, they would still be peer-led as staff. It's a lived experience organisation, and I guess I'd be interested to hear more about, the facilitators, what the roles are, how they're supported, that kind of stuff.
Yeah, sure. And back to the part about trying new things, we have a saying in the team, which is essentially we're constantly building the airplane as we're flying it. So yeah, it's a risk, but we're learning a lot from the process. Back to the facilitators. So I think this is one of the things that we are learning. We tried. I think the initial portion when we first conceptualized the program, it was meant to be as much as possible close to peer driven and peer led. So the initial conceptualization of it, we saw it as training and equipping CR members themselves to step up and volunteer, and then they lead their CRs eventually. And I think to a portion that has come true, right? We have CR members who have stepped up, decided that, hey, I want to do a bit more, and we've trained them through a particular training course that we have. But it's also something that we've found that over time, so we've been running this for about a year and a half, slightly a bit more. It's not as quick and as seamless as we hoped it would be. So I think some of the challenges that we face are, of course, then the pace of people volunteering, the comfort level that they would have, and also then because being peers and recovery not being linear, there are times where as facilitators, they would go through a spiral or they would go through a difficult time and they would have to drop off for a period of time. So operationally, it takes a bit of planning. So our volunteer pool of facilitators now, a mix of them are CR members themselves and peers. We also have volunteers that are externally, that are from external recruitments. So we put out the word through social media and they will sign up for the opportunity to be trained as facilitators. Training per se, it's fairly straightforward outside. The training takes place over a day, over the weekend, typically on Saturday. So it focuses on what the CR is essentially, what are the principles that guide peer support within the peer support group, what are some of the community agreements that we have in the CR, what are the 4 Rs, operational details like that. We also devote quite a bit of time for role playing, because this was based on feedback from past cohorts that said that it's a bit hard. I mean, a lot of them are on the receiving end of peer support all this while in a group, so it's a bit hard to visualize what it means to actually facilitate. So a good half of the day is spent on role playing. But beyond the training itself, so one thing that we were quite intentional to do was not to assess competency after one day of training. I think we felt that we wanted to give time for, especially for peers, right? Time to kind of gradually, progressively, and incrementally fill the group, fill the role itself, get a sense of it, and build their competency over time. So we have practice sessions. They will go back to their groups, and between 3 to 5 times they can have practice sessions for up to 5 sessions, and they would co-facilitate with the staff. And after every session like that, there will be a debrief where the staff will go through them, share some feedback with them, how they can improve, what they did well, and eventually when they are ready, they will let us know when they would like to be assessed to be competent. And once they are competent, then they can be deployed individually and independently to facilitate the groups. So that's typically what a volunteer would go through if they did volunteer to be a facilitator for the CR.
Yeah, it sounds like a really supportive process that, it's, there's some of the training and then there's working with someone else and there's the debriefs and sort of, a bit of reflective practice and really to build up, because I can totally see that, you know, when you're switching roles, you know, it takes a different way of thinking about things and understanding the dynamics. And yeah, great. Thank you for sharing that.